In this lesson, you will learn how reproductive health is protected through informed decisions, prevention, and shared responsibility. Look at the central decision board. Several health choices lead toward one common goal of well-being. The lesson will help you read those choices carefully, compare what different methods can and cannot do, and recognize when professional health guidance matters. Reproductive health includes physical, emotional, and social well-being. Informed and respectful decisions connect all three parts of health. The equal-sized circles show what should not be left out. Reproductive health includes physical, emotional, and social well-being. No single dimension represents the whole idea. Reproductive health decisions can affect the body, emotions, and relationships together. Reliable information, respect, and qualified health guidance help people make responsible choices. The center card turns the definition into a decision rule. Good reproductive health decisions are informed and respectful. Reliable information and personal dignity both matter. Use all three circles and the center card. What does reproductive health include, and what kind of decisions support it? The model combines the health dimensions with the decision principle. Reproductive health includes physical, emotional, and social well-being, supported by informed and respectful decisions. The three circles show that well-being is broader than physical health alone. Next, we will compare barrier methods, oral contraceptives, IUCDs, and surgical contraception by how they work, reversibility, and professional involvement. Barrier methods, oral contraceptives, IUCDs, and surgical contraception differ in broad mechanism, reversibility, and professional involvement. The comparison should guide understanding, not personal prescribing. Use the same three criteria across every column. Contraceptive methods differ in mechanism, reversibility, and professional involvement. One category should not be judged by the features of another. The categories reduce pregnancy risk through different broad mechanisms and have different reversibility. Because personal suitability varies, qualified health guidance is important for individual decisions. The comparison ends with an important boundary. Method comparison is not personal medical advice. Individual contraceptive choices should use qualified health guidance. Compare the four columns using the shared criteria. How do barrier methods, oral contraceptives, IUCDs, and surgical contraception differ broadly? The rows show the comparison without prescribing a personal choice. Barrier methods create a physical barrier, oral contraceptives use hormones, IUCDs such as copper T are reversible devices placed with professional involvement, and surgical contraception such as vasectomy or tubectomy blocks reproductive pathways and is generally intended as permanent. The categories also differ in reversibility and the level of professional involvement required. Next, we will compare pregnancy prevention with protection against sexually transmitted infections. Condoms help reduce both pregnancy risk and transmission of many STIs. Other contraceptive categories generally reduce pregnancy risk, but do not prevent STIs. The two rows represent different protection goals. Not all contraception protects against sexually transmitted infections. Pregnancy prevention and infection prevention are related but different goals. Condoms provide a physical barrier, so they can reduce both pregnancy risk and transmission of many STIs. Other contraceptive methods work differently and generally do not provide STI protection. The mechanism explains the protection difference. A condom is both a contraceptive barrier and an STI risk barrier. Other contraceptive methods generally do not provide the same infection barrier. Use the two rows rather than looking at only one method. Which contraceptive method also helps reduce transmission of many sexually transmitted infections, and what is the key limitation of the other methods? The matrix separates pregnancy prevention from infection prevention. Condoms, a barrier method, help reduce both pregnancy risk and transmission of many sexually transmitted infections. Other contraceptive methods generally do not prevent STIs. The two protection goals should not be treated as identical. Next, we will examine HIV transmission routes, ordinary contact that does not spread HIV, and the difference between HIV infection and AIDS. HIV spreads through specific exposure routes, including unprotected sexual contact, infected blood or shared needles, and parent-to-child transmission. Ordinary social contact does not spread HIV, and HIV is not the same as AIDS. The two zones separate real routes from everyday myths. HIV is not spread by ordinary social contact. Touching, sharing food, or sitting together are not HIV transmission routes. HIV transmission depends on specific exposure routes, so ordinary social contact does not spread it. HIV infection and AIDS are different. AIDS is the advanced syndrome, not every HIV infection. The bottom strip corrects a second common misunderstanding. HIV infection and AIDS are not synonyms. AIDS refers to the advanced syndrome, while HIV is the virus that attacks the immune system. Classify the examples by route rather than by fear. Which routes can transmit HIV, which ordinary contacts do not, and how is AIDS related to HIV? The board separates transmission, non-transmission, and disease stage. HIV can be transmitted through unprotected sexual contact, infected blood or shared needles, and parent-to-child routes. Ordinary social contact, such as touching or sharing food, does not spread HIV, and AIDS is the advanced syndrome rather than a synonym for every HIV infection. The three parts of the board address different misconceptions. Next, we will connect family planning, spacing, maternal health, shared responsibility, equality, and qualified health guidance. Family planning and spacing can support maternal health when responsibility is shared. Personal medical choices need qualified health guidance, and sex selection is illegal and unethical in India. The center of the image shows who should carry the responsibility. Family planning is a shared responsibility. Informed decisions should not be pushed onto only one person. Planning and spacing can support maternal well-being, especially when decisions are shared. General information should lead to qualified health guidance for personal choices, while equality requires rejecting sex selection and discrimination. The health service card sets the practical boundary. Personal reproductive health choices need qualified health guidance. Classroom comparison cannot replace individual medical assessment. Use the shared table, health service card, and equality symbol together. How do family planning, spacing, shared responsibility, qualified health services, and equality connect to reproductive health? The image links health, responsibility, and ethics in one system. Family planning and spacing can support maternal health when responsibility is shared. Personal medical decisions use qualified health services, and equality is respected. Prenatal sex determination for sex selection is illegal and unethical in India. The central table shows that health decisions and social responsibility belong together. Next, we will bring contraception, STI prevention, HIV knowledge, and shared decision-making into one complete reproductive health framework. Reproductive health combines contraception, STI risk reduction, accurate HIV knowledge, qualified guidance, shared responsibility, and equality. Different tools protect different parts of health. The branches stay separate because they solve different problems. Different reproductive health tools protect against different risks. No single method should be assumed to solve every problem. Contraception, infection prevention, HIV knowledge, and professional guidance have different roles. Keeping those roles separate leads to safer, more accurate, and more respectful reproductive health decisions. The map gives us one final organizing rule: match each health goal with the tool that addresses it. Accurate decisions begin by identifying the actual risk or need. Use the branches to match each tool with its purpose. Why should contraception, STI prevention, HIV knowledge, and qualified health guidance not be treated as the same thing? The concept map separates their jobs before reconnecting them. They address different parts of reproductive health. Contraception reduces pregnancy risk. Condoms also help reduce many STI risks. HIV knowledge supports infection prevention and reduces myths, and qualified health guidance supports personal medical decisions. Keeping the roles separate prevents false assumptions about protection. Next, you will apply these distinctions to unfamiliar health information cards and decide which claims are supported. Use the visible evidence to test each claim about contraception, HIV, professional guidance, and shared responsibility. Accurate conclusions should match the lesson's protection and decision rules. Treat each claim like a small evidence problem. Reproductive health claims should be checked against evidence. A familiar-sounding statement is not automatically correct. Each claim fails for a different reason: wrong protection goal, wrong transmission route, ignoring individual guidance, or unfair responsibility. Evidence helps replace each misconception with an accurate statement. The strongest correction names the exact mismatch. Identify the error, then replace it with supported information. Good health reasoning explains why the original claim fails. Choose the claim that confuses contraception with infection prevention. Which card shows the misconception that all contraception prevents infection, and what evidence corrects it? The protection matrix provides the deciding clue. Card A shows the misconception, and the evidence corrects it by showing that condoms help reduce both pregnancy risk and transmission of many STIs, while other contraceptive methods generally do not prevent STIs. The two protection goals are not identical. You are now ready to use evidence, accurate prevention knowledge, qualified guidance, and shared responsibility when reasoning about reproductive health.